So we are going to wait until the people jump on here. Just give them just about 5 minutes or so before we get started. Thank you, Father. So it looks like there's 9 on so far. I want you to put something in the comment section right now. Let me know that you're on. You can put in the comment section your name. Actually, just put the state that you're from in your name will be great. Put that in the comment section. Put it in the chat section. There's 11 of you on. I see you. Come on. We're waiting on you to come on. Hi, Sharon. Hey, what state are you from? Hi, Regina. Put in there what state that you're from. I want to know. There's 13 of you on. Come on, guys. I'm waiting on you to come on. We're going to be getting started shortly. We have a great night for you on today. Hi, Karen from Texas. Good to see you, sweetheart, out there. Hi, Maxine from Michigan. All right, come on, guys. Put it out there. Let me know where you're from. We're going to be getting started in a moment. Put your name in Pennsylvania, Regina. Good to see you. All right, that's really good. I'm liking these states that I'm seeing out here. Come on, put those states and name out there so I can know where you're from. We got an excellent show. Janice from Wisconsin. Come on, guys, put your name and what state you're from out there. We're going to be getting started in just a moment. I just want a few more to come on here. Also, looks like, okay, we got a lot of YouTube that are out here. I want to see some Facebook out here as well. There's 16 of you on here. I'm not seeing many Facebooks at all. Come on, Facebook. There's 17 of you on there. Come on. We're waiting for you to come on. Missouri, Sharon from Missouri. All right, I see Karen from Texas. I don't know if I said that already, but I see Karen from Texas. I see 18 of you on. Come on. 20 of you on now. We're going to give them just a little moment longer because we got a great show for you on today. Let me know what city, what state you're from, and give me your first name. We're going to be getting started in just a moment. All right. We are going to get started here. I'm really excited because I want to say to you guys, welcome to our podcast, the Sandra Burnett Lifestyle Podcast. I'm your host, Sandra Burnett. This is actually our first podcast at 7:30 at night. So this is really, really excited to me and for those that have already joined the podcast before. So this podcast is at 7:30 on Thursday. We will be talking about all different kind of topics, but today we have a special guest that will be sharing good information for us on today. Our special guest, she's a pastor. She has a lot of initials behind her name. She's an MD. She's a CHWC. She's an RMA and an MBA. We're going to be bringing her on in just a moment. But ladies that are out there, and if there are any men out there, you have a treat for you on today. And so I want you to put in the comment section right now, just welcome my guest. Just say, welcome, Dr. Dahlene. Come on, put that in the comment section. Welcome, Dr. Dahlene. And I want Facebook members to jump on and be a part of this chat on today, because this is really, really exciting. All right. So also, I do want to say, just want to give a little announcements before we get started on today. That again, we have Facebook and we have YouTube that are on. And I want to say to you guys, thank you so much for joining me on today. And I do want you to put in the comment section what state you're from and what city that you are from. Also, I do want to say that those that are on Facebook, put in there what city, what state you are from. And now I see some Facebook out there. All right, Dahlene, I see you out there. Thank you for jumping on. I also want to say, put in, let's just see here. Before we get started, I want you, if you have not subscribed to my channel, subscribe today. And also, I want you to click on that notification button so that you can be notified when I post new videos, and give me a thumbs up. Keep all of that coming, because you're helping my channel move along. I also want to give a disclaimer before we get started. This is a generalized information and is a limited summary of opinion and treatment in or medication information. The information today is used as a tool to help you understand potential treatment options that you can have. We are not responsible for your health issues or results here. You must consult your healthcare provider for complete information about constipation or different other medical issues that you may have concerns about. This information does not endorse any treatment or medication as safe, effective, or approved for treating you in any way. So that, just to let you know, this is going to be some good information, and we want you to also listen in, and then also we're going to have Q&A, and so we're going to allow you to ask some questions as well. So we're really, really excited today. So I am so happy to actually introduce to you my friend, my team member in a ministry, Dr. Dahlene Paasewe, very qualified for what she's going to talk about on today. So you're in for a treat. And so I am going to bring her in, and just bear with me, because I'm the person operating everything on today. We're going to get that taken care of it as well. But let me bring her in for you. There she is, looking beautiful on today. This is Pastor Dr. Dahlene Paasewe, and we're really excited to have her with us. We are going to again talk about constipation, how to cure it. We're going to give you some healthy remedies that's going to help you along the way. And so, Pastor Dahlene, if you can just, actually, she stepped away.
I'll be right there. Okay.
Thank you, Lord Jesus.
Amen.
So we just best bear with us, the little technical problems here, but we're going to get it just right for you on today. I see there's 22 of you on here. Come on, tell a friend, tell a neighbor that we are on the podcast with Sandra Burnett Lifestyle on YouTube and on Facebook. Tell them to come on and jump on in and be a part of this, because we're going to give you some really, really good information on today. And so let me just go ahead and keep going here as she prepared it set up there.
Can you just take me off and bring me back on 1 second?
I sure can. All right. So I do want, while we're waiting for her to come, this is one thing I did want to tell you guys. In the comment section, if you can put in there some topics on podcasts that you would like to learn more about. Now, I do want to say that, again, the name of my channel, as you can see from the bottom of the screen, is Sandra Burnett Lifestyle. So when we say lifestyle, my channel talks about faith, it talks about hair, As you can see, all my bushy hair here. It talks all also about lifestyle. So it's going to be any topics from marriage, from singleness, from how to date, for health issues that you may have, just topics everywhere, helping you with different situations in your life that's going to help you. We're going to be talking about it. And so this is going to be a really good podcast for you to come to every Thursday at 7:30. And I do want to say, while we're waiting on Dr. Dahlene, that on every Tuesday, listen to this, at 5:45 in the morning, we are on Growing in the Word. And I tell you, it's a powerful podcast, a powerful teaching to jumpstart your morning. So join us also every Tuesday morning at 5:45 in the morning. And then every Thursday we're here at 7:30 for another podcast. And then during the week, if you go to my channel, I see 25 of you on here. Great. If you go to my Sandra Burnett Lifestyle YouTube channel, you will find all kind of information about hair, my lifestyle, just good information out there, how to take care of your natural hair. So also don't forget to go check out my channel, my YouTube channel, after this podcast. Again, share the podcast with somebody. We want you to let the people know that we are on. And so Dahlene looks like she's ready now, and I am going to bring her on. Dahlene, thank you so much for joining us on today. We're really excited that you are here, looking beautiful.
So am I.
Good. I do want to say to you, so we're going to get started, but I do want to say, before we really jump into these questions, that people need to know a little bit about you. And so just tell us a little bit about you, and then a little bit about your medical background, and then we're going to move forward.
Okay, well, I am Pastor Dahlene Brown Paasewe. I am a medical doctor. I've been a medical doctor for the past almost 30 years, over 25. Sometimes those many years is kind of hard to count exactly. But over 25 years, going to 30, I've been a medical doctor for the past 10 years, 12 years within Milwaukee, Wisconsin. I've been more on the educational side. So I'm a certified instructor, and I'm at a local community college where I teach healthcare to entry-level nursing students, as well as to medical assisting students. In Liberia, I was also an instructor in our medical college, or an assistant instructor in our medical college, and a full instructor in our nursing and physician assistant school. And quite recently, with my passion in healthcare, I have decided to go further and learn the other side of healthcare, which is to be a health and wellness coach. And so I am a certified health and wellness coach, on my way to be board certified health and wellness coach, where we can be able to help people see how they can prevent from even getting to the bottom of the ladder. And I find myself in a very interesting place, I would like to say, because I've learned how to be a medical doctor and practice in that field. And I see that we got trained how to help people when they reach the bottom of the ladder in their illness. And now we're trying to help bring them back up. And in the profession of certified health and wellness, and I like to put an emphasis on wellness. In certified health and wellness coaching, we help people to prevent them from getting to the bottom of the ladder. And so we don't treat, we don't diagnose. As a certified healthcare coach, as a medical doctor, I do. And so I feel I'm in a very good place to be able to tell people about their health, because as a medical doctor, I know a lot about the body. My specialty in my practice was general practitioner, which here is similar to like a family practice physician. And so that gives us a little bit of all the areas. And in my experience, I've practiced medicine and surgery as well, delivering babies, doing C-sections and natural deliveries, appendectomy, taking the appendix out, repairing hernias and things like that. So I'm so excited to be where I am right now, helping others to pay attention to their health so they don't reach to the bottom of the ladder and come and see us as you were going to see the physician, but to help you before you get there, giving you some tips and skills that can help you along the way. So I'm also a minister of the gospel, and I'm so excited about that. And that's where I met this amazing lady, Pastor Sandra Burnett, and she is a sister of mine now. So over back to you, Pastor Sandra.
So that is awesome. So we can see
That's
that
a
we
little bit
have
about
someone.
me.
We can see that we definitely have someone well qualified to share with us on today. And so I'm going to jump right into these questions here. There are so many people that deals with constipation. I know this is something that a lot of people don't like to talk about, but it's something that definitely needs to be talked about because this is something that can become a very serious issue in a person's life. So if you could just share with us what is constipation.
Well, that's a very interesting question because I think many times people feel constipation is only when you're straining to toilet and you can't go to the bathroom. But constipation pretty much is when you're not able to produce or eliminate empty your bowel effectively more than 3 times a week. So people who are able to go to the bathroom only, less than 3 times a week is considered constipation. But also, constipation is also considered when the bowel is not effectively emptied. So that means you can go to the bathroom daily, but so long you still feeling that incomplete emptying, which can happen very often. You can go 1 time, 2 times, but you still feel that something is still there. That's part of constipation because when someone completely emptied their bowel, they're supposed to have a total relief of feeling of I'm done with that. That's done until the next couple hours or whenever I'm going to go to the bathroom. So pretty much that's what constipation is. Got more to do with the frequency of which you go to the bathroom with a complete emptying and that complete sensation of the bowel that I'm done is emptied. See ya later, bathroom. So that's what constipation is. And it's while I wait for Pastor Sandra to get back on the line, I would just say that it is something that affects many, many, many people.
Mhm.
20% of adults are constipated, and the more we get older, the more
Mhm.
likelihood there is for constipation to happen. And it kind of worsens with age. But adults that are over 60 years of age, 1/3 of them, which is like yeah, a good bit of adults, about 33% of adults over the age of 60 are constipated. So it's something that's very common.
And I do want to say, those that are online right now, those of you that are, can you just put in the comment section like over 30, over 40, as far as age, over 60? Just put that out there so that we can kind of get an idea of who's on here, the age, so that that can also help us in preparing what to say that is going to benefit you, so we won't be all over the place.
Yes,
So if
right.
you can put that in there, over 60, over 30, over 40, over 20, just kind of say that, but just stay within a 10-year span. Yes, yes, Dr.
And
Darlene.
I just like to say that's just the average for adults, but we know that, young people, older
Hmm.
people, we all can get constipated at any age group. That's just the statistics on the
Right,
frequency of, how many people are.
right. That's right. And then they're putting, there's a lot over 60, over 50, over 65. Okay. All right, that's really good. Keep putting it out there so that we can see the ages here. Also, because so let me come to another question here.
Mhm.
So this is a question that a lot of people constipated and they really don't know why. What caused constipation? Can you just really give us some enlightenment on that?
Sure. Well, just as I'm about to answer that question, let me share with you that there are pretty much two big categories of constipation. One of them is where It's called primary constipation, and the
Mm-hmm.
cause of that is from the bowel itself. Like, and I have a prompt here. So let's say
Let
this
me
is your bowel. This is your
let me expand this for you so that they can.
okay. Okay. So let's say this is your colon, and if someone is constipated for the reason of the actual structure and function of the tissue itself, that's primary constipation. That means the person is constipated due to the muscle not working well in the colon, or the nerve supply is not working well in the colon, or the structure or something that has to do with the colon itself, and that's primary. So most of the constipation that we deal with, that we see people deal with, is very much what we call secondary constipation. So it's not the problem with the actual colon itself, but it can be due to so many different things that can cause that kind of constipation, which is secondary constipation. And so the causes are so many. I think I was just going to mention a few, and then we can take questions about different kinds or different reasons. But one very common reason is the standard American diet. The diet that we have is one that doesn't have enough fiber in it, and because of that, the movement of the content of your colon, which is your feces that's inside your colon, it moves very slowly. The standard American diet is number one thing that makes people to have constipation. There's not enough fiber. Another reason is people don't drink enough water, like dehydration. And it's not only that you're not drinking enough water, but sometimes the things that we drink, like a lot of coffee throughout the day or a lot of iced tea throughout the day, those things work as diuretics. And diuretics just means that they make you go to the bathroom more than what you really want to. So you're drinking 3, 4, 5 cups of coffee, it's making you go to the bathroom. So it's really taking away water from in your feces. And so the way the colon is, if you have this here, in content is supposed to pass through here and, work its way through this whole system before it leaves your body. If you're not drinking enough water, it makes it dry and it makes it hard for it to move along or move along that area. So not having enough water in your diet or things that will make you to lose water can cause people to get constipated. Another common reason is a sedentary lifestyle. What does that mean? It means it's a lifestyle people do not move a lot. It's not only like typical exercise. So when we say exercise, it makes people think, oh, I gotta go to the gym. But it's not always that you have to go to the gym. It's just moving around more, walking more, taking some strolls, doing a little exercise here and there, not anything major. You don't have to go to the gym. But that's the sedentary lifestyle that you want to park to the closest place to the grocery store. You don't want to walk a long distance to get there. Or at work, instead of taking the stairs, you take the elevator because it's shorter. So you just from your car, in the house, in your chair, back in the car, back in your house. And sometimes we have stairs in our houses that we can even help us to move up and down, just going up and down the stairs. But anyway, that's one of the reasons why we have constipation, because we're not moving a lot. So we'll come to find out that the more we move, we are, it's a good chance to help to get our bowel content moving. Another thing that can cause people to get constipated a lot is some conditions that we have. The hormones that are responsible for those conditions help to make your bowel slower, moving slower. Now, let me use the word, when I talk about moving, let me just use the word transit. Your transit time is slow. Think about if you travel by air and you're at the airport and you have to connect a flight. That is called, you're in transit, right? That's what we call it. I'm in transit. That means you're waiting to get on your next plane. Or even if you took a bus and you're traveling by bus on a long distance, you get to a place and then it's like, oh, I have to wait to pick up my next bus. Or even in the city, you have to wait for one bus and then you got to wait for the next bus. While you're waiting for it, it's called like a transit time. You're waiting. And the foods is supposed to have a high transit along your bowel. It's supposed to move, and it usually moves with something that we call peristalsis. Peristalsis is just a big word for movement of the bowel, and some of those involuntary movements that we, in fact, we have it all the time. But I'm talking about those ones that will embarrass you sometimes when you're hungry or you don't know, you just hear, you just, and then you be like, oops, I'm sorry, you heard my gut move. That's peristalsis. And so anything that will slow down that movement of food through the bowel from the time you eat, and if it's taking too long to go, it's a problem. So for example, some people can go to the bathroom once a month. I mean, that's the extreme of chronic constipation. And some people can go only 3 times in a month, and that is real serious when that happens. But sometimes it's certain conditions going on with their body that cause that. Even diabetes, uncontrolled blood sugar can help to make that transit slower, which means it's the same as on say it decreases the mobility, or not the mobility, but the motility, because motility is the movement. It decreases the motility of your bowel. Sometimes we have other diseases. Sometimes it's other immune diseases, diseases that exist like hypothyroidism. In the body, your thyroid function is slower than what it should be. It's going to cause your bowel tissue to move slower than it should. So even pregnancy, let's talk about some regular things. Pregnancy can cause that. And I see most of our ages are 60, 50 and older. But you still have people in your lives. You might have children who's in childbearing ages, or, family and friends that you love that are in those ages. So those things are also important. So in pregnancy, you can have that. But then we'll also have some medications that can cause constipation too. And the reason for pregnancy is because of the hormones, the progesterones are high. So in pregnancy, and so that slows the movement. It reduces what we call gastric motility, colonic activity. It reduces that. Iron supplements that can help to slow down your bowel movement as well. Even when you have calcium, excessive calcium you're taking excessive calcium supplements, that too can slow down. So there's so many things that can slow down the bowel. But before I stop giving you some of these causes, let me talk about gas. We'll call methane gas. That can slow down the movement of your bowel. So signs and symptoms of constipation, let me just say that while I'm at it, Pastor Sandra, is one of the common things of constipation as a sign. Someone might be bloated, and that bloating is gas that has formed. And with that gas that has been formed, it's like a vicious circle, because gas by itself is like you driving a car and you slam the brake and stop the car from moving. Gas is like that. Gas slows down the movement within the bowel. And other symptoms that someone is constipated besides the bloating just might be that feeling of, I don't feel complete. I went to the bathroom, yeah, but I still feel like I need to go. Like I was saying before, that you can go, but you can still be constipated because you go. So that's just a few of the reasons. I'll stop there when it comes to the different causes of constipation, Pastor Sandra.
Okay, so I did want to say, um, you know, there's certain foods that we eat that can cause constipation. And I'm sure some of us want to know, what are some of the foods that can actually cause constipation that we eat? And I know a lot of times we don't eat right. Like me, sometimes I get up and the first thing I do, which is a really bad that I do, but I would eat something sweet. I grab some candy or something. That's the first thing I may put on my stomach early in the morning. And so, and let's just kind of give us some different foods that can cause constipation, that if you can think of any. And then I also want those that are out there, I want you to put in the comment section a question that you may have, because along the way we can start answering your questions. So in the comment section, I'm going to watch it closely. Put in there a question that you may have. And I'm going to bring Dahlene, Dr. Dahlene, back on here.
Okay. So when it comes to food that cause constipation, it varies from person to person, because even for some people, bananas, you would think, is something that will give them a free bowel. And for some people, it would be bananas that
Okay.
will will make them to be constipated. So I do not have an exact list of food for that very reason, because everyone is different. But there are some things that across the board will cause constipation, like powdery foods. Let's say protein powder, because people have a
Mm-hmm.
tendency to do a lot of protein powder or protein powder drinks, and that will cause constipation for people. And so let's say, for example, if you need protein, most of the time we get enough protein in our diet that we don't have to do extra protein powder, for it. But definitely that can cause constipation for some people. If we need protein, you eat your meats or eat plants. Plants are excellent in protein and fiber. We have plants, we have meats, or we have animal protein, right? But the only foods that you will find with protein and fiber together combined in one are plants. Plants
Mm-hmm.
have protein and they have fiber. So eating a lot of plant-based diets, or even if you're eating your animal protein or you're eating other kinds of protein, it's good to eat plants that contain protein, which are like nuts, and you can find them in lots of the legumes and seeds that we eat. They're very
Mm-hmm.
good, in fiber for
Right.
us. Just
So,
some of those things that can add fiber. Yeah.
so you know, I've heard doctors say, like you're saying, the plants, eating a lot of vegetables, things like that will help. Um, I was watching the other day, this one lady that was talking about people that have constipation problems. And sometimes when people go to the bathroom, they still have a hard time, because they don't, because they wasn't eating right, like you said, or drinking enough water. So when they're trying to have this bowel movement, it's hard to let it flow through. And so this one lady was saying that she was like from like Japan or China or something. And she was saying that this really helps. And her mom, she was saying, still practice this. That when she goes to the bathroom, she takes like a stool or something, let me just grab something really quick to show you. This is a box here. So she takes like, I'm going to say probably a box about this high, and she puts it on the floor. And then she puts her feet on top of the box and her back up straight, which helps the soil to pass on through. Now I'm gonna tell y'all something. I literally tried that
And it worked.
and it works. So I
Exactly.
want to say to y'all, anybody out here that's dealing with constipation, get yourself like something that maybe this high off the floor and wide enough for you to put both of your feet on there, and then sit down and stand your back up straight. And when you begin to pass the store, it makes it so much easier to pass through. That's just a tip right there. Y'all know I got my healthy hair tips, but that is just a healthy health tip for you
That
guys.
is correct. That is true. That
Mhm.
is very true, Pastor Sandra. And so let me just share with others one. Let me show you something that will help to make you understand that there definitely is a proper pooping position.
Right.
You know, because it's all about the anatomy. And I like to say, as I explain that, anatomy and physiology, common words that we use, they
Hmm.
kind of like married to each other. If
Right.
the structure is right, it will function right, and when the structure is off, it's not going to function right. And
Exactly.
so when we look at this right here, I'm going to show you one model here. This, for example, is an example of your entire GI tract, okay? All the way from the mouth, how the food travels down. You have the stomach, it'll travel to the stomach, and then it'll come here and get in the small intestines, and then it'll come this way and travel across here to the large intestine, and then it comes out here through the rectum, and then the opening there is the anus. So most of the time when someone go to the bathroom, they might say, oh, I just went to the bathroom, but I still feel like I want to go, because there might still be something still sitting here in the rectum. not the anus. The anus is just the opening. The rectum is that. And before the rectum, it still has another little curve that it has to pass. And I will demonstrate that by using this. And this right here is actually a little representation of what your bowel looks like. And Dr. Paasewe, what did you grab this intestine from? Well, I have a little man here, and this intestine belongs in this little man right here, right here. So if we were to put this in place, it'll sit somewhere right here. And so this right here is the lower bowel, like your belly button might be sitting somewhere like here. And so this, because of this structure, how we have the food comes down like I was showing you, and it gets in the small intestine first, then it gets in the large intestine, which goes up, and then it curves straight across the belly, and then it comes down on here. Hey guys, all of this is where your poop is sitting. In this gray area is where your poop is sitting. In the middle there, we don't call it where your poop sits. That's where your food is, and some of that food is still being digested. Most of your food, your body wants to take it from here to enter your bloodstream, which is in a small intestine. So there should be, that's the area. And then after your body has taken off what it really wants, it's going to let go of the ones it does not want or is not able to absorb. And that's where fiber comes in. And all of that would be here. All in this gray area is your large intestine. Everything in your large intestine we want to get rid of. And so if we do not evacuate that properly, it's going to continue to build up and build up. It is like, who's traveled on the highway before? And you have, maybe you see an accident along your way when you're passing, but the effect of that accident on the other lane is far reached, because as you are continuing to go, you see cars backed up and backed up and backed up, all because of that one accident that happened earlier on the road. And so that backup is like unable, it's like your feces now, which is all in this gray area, unable to continue moving because this is just working slowly. Okay, it's working slowly. It's not moving fast enough. All the food here not moving fast enough. So when it is time to empty, you need to sit the right way. And I know we can all sit on the toilet. Before Pastor Sandra learned about that, what she just showed us, I'm sure she would just sit on the toilet and she would try to go, and if she couldn't go, she was strained, and then that's not good because it can help us to develop what we call hemorrhoids as well. So there's a proper pooping position, kind of, and that is where you will sit on the toilet and bend your knees so that your hip is higher, than your bottom, your legs to come up. And I have this little structure here to help us to see. So if this was somebody sitting on the toilet, you will sit and you would raise your leg. And that's why we had that stool she showed.
Mm-hmm.
Raise your leg up like that. And then your knees will start here. Your knees will come this way, right? Your knees down like that. Raise your foot up and put it on a stool. Mm-hmm. Or you can take a garbage can, put that on there. You do that. So once you do that, what you're doing is you bending your legs up so that in here, how we had all this bowel content that we saw right here, you want to create a natural, without straining. This helps to create a natural pressure without you straining. So let's say we're to put this on this man right here, and we lift our feet up. Do you see how when you lift your foot up, mm-hmm, it's going to press on this? And then you also bend over a little bit with your back straight on the, you're not curved, but you do that. You bend over a little and then your feet up a little. Can you imagine how that will create a normal, natural pressure here? And all you need to do is to take a deep breath and do a gentle push. And it will help to bring your food down. Bring that feces down that have formed from your food. So this way, it helps to create a natural pressure by you raising your thighs. And either sometimes they say you can put high heel shoes on, or you can put a box and put your feet up on it. So then your thigh is bent up like that, creating that natural, just a little deep breath, a deep breath and a little push. Because when you strain, we do not want you to strain. Straining is not good. Straining can cause more problems for you. So that's a good position to help us get rid of constipation. Other things that you can do if someone feels that they're constipated, you can do what we call an intestinal massage. And that is, now that you understand this anatomy right here that I showed you, now that you understand this, you can lay flat on the floor or on your bed. You can lay flat on your bed and move in, say, a belly button. If your belly button is right in the middle there, you want to just move it in circles. Right here, you will be kind of stimulating the contents of your small intestine, just gentle small circles right there, gentle small circles around your belly button, just for a few minutes, but gently, not too hard and not too light, like you want to press down, maybe press some butter or something, like mashed solid butter, just that little amount of pressure. And then when you're done doing that circle, gentle circles around there, you just move and trying to um, encourage your contents there to move a little bit. And then you can also, after you're done with that one, you can come kind of midway between your belly button and this little bone right here, midway there and a little bit down. Is, you can see that's just where the large intestine will start. And then you begin to move your hand up this way, just gentle movement upward, not downward, because now you see the anatomy. It goes up and then it comes across and then it comes down to the side. So you will go a little bit up, massaging that gently, not too deep, just gently in a way. And then if you start to feel gas, let the gas out. It's just you. You want to let go of that gas. And then you will now add the middle part to it. You will go up and massage across, up and across, up and across a few times. And then you will do a full U shape. So this is like I and then like a L now. And then when you bring it down on this side, it makes a U. So you can say, Bowel, I love you. Bowel, I love you. Move for me. I need you to move for me. I love you. I know you love me too. Bowel, I love you. And you just kind of like do those gentle massages around your bowel, and that helps you to go. And you know, the rectum area is going to be hard for us to really find a way to massage that area. But if you just want to feel your pubic bone, and we all know where our pubic bone is, hopefully we do. Your pubic bone is right below, right there, where that bony area is, right there. And then this is your pubic bone. And for us women, we have pubic hair right here. And then right there, below, right above this, you do some gentle massages there. Just press down in there just a little bit, because below that area is where your rectal area will be starting, not the anus is in the bottom, but the rectal area. So just with that, that can help you to get your bowel to move. So that's one remedy, is that technique, sitting on the toilet with your legs bent, your thigh bent like that, and then a little bit over. Just deep breath and a gentle push will help you to get that down. So that is one technique. And then massaging your belly is another one. And then, you know, you can always do some yoga exercises at home. And one common one that's been shown to be good is to lie flat on the floor with your legs on the couch, you know, your bottom here. You put your legs on the couch And then you have something resting under your head, maybe roll a blanket under your neck. And then you will need a little weight, maybe a little, maybe a roll up a blanket and put it here on your stomach. But what you're going to do now is with that leg here raised up on the couch, you can take one knee and pull one knee towards you gently. What you're doing now, you got a little blanket here, right? And then you're going to bring this knee here. So just like you would do a regular knee pull, pull your knee on one side with the blanket there, or you can put a little weight, maybe a little books, maybe a book or two, not up on your top, on your stomach, but lower abdomen to where your body is. You can put a book on there. So just something, a big book that has a little weight on it, so that when you pull do your knee pull to you, pull your knee one time, a few times. You can do that for about 1 minute. And then you drop that knee, it's up on the couch. You can take your other knee and do a knee pull. Pull your knee towards you. You're creating some pressure. You're creating some, um, trying to encourage some movement there with that little weight on there. And then when you're done with that, you can bring both knees together and just kind of do a gentle movement, gentle maneuver like that with both knees. Remember, you're laying flat on the couch, flat on the floor, your legs up on the couch. You've been moving your knees towards you here. And now you're just going to rock in that motion a little bit. So those are, 3 different things that you can do to help you at home remedy. And also at home, you can make your little prune juice. You can put a little concoction together. For the lack of a better word, I call it concoction, but it's all natural things like prune juice. And in the prune juice, what you want from there is it has some insoluble fiber that is in that prune juice. You can mix that with applesauce. And then also you can, and in the applesauce, you have soluble, what we call is another day discussion. Might not have time for all of the details today, but it's insoluble fiber in the apple. The pulp of the apple is insoluble. And the skin is, the pulp of the apple is the soluble fiber. And soluble means if I put sugar in water and I can mix it like this, it is completely going to mix up. And this is actually sugar, it's raw sugar. So it doesn't have a white color, and this is more natural sugar, the raw sugar. It's like a brown color sugar. So if you put that in the water, this is soluble, right? If you stir this, and I did earlier, that gave me this color, it's going to be totally soluble. But look at this. There's some fiber that is not soluble. And so that's what I'm talking about in the prune juice. There's some parts of it that will not dissolve. So this I put in this cup like earlier today when I was preparing for you guys. And till now, you can still see the settle. So this is definitely not soluble in water. And this is just some cream of wheat. I just know something that I knew wouldn't melt, wouldn't dissolve in water or soluble. See? So you have all this soluble, this content is not soluble, it's insoluble. And so with some of the fiber, some fiber is soluble like this in water, completely will mix up and disappear, whereby some others will not. And the ones that will not dissolve in the contents of your food in your bowel will be there to help make the contents of your bowel expand and stretch, and that will help you to go to the bathroom. So it's prune juice, it is applesauce, and it's oat bran. So when you put those 3 things together, like oatmeal is not like grits, something like grits. If you put that together, those 3 things together, mix it up together. How much? You're going to put the same amount of prune juice, the same amount of applesauce, the same amount of oat bran. So if you put 1 cup of oat bran, it'll be 1 cup of prune juice and 1 cup of applesauce. The same measurement of all. Or half cup of this, half cup of that, half cup of the other. Put them together and then mix it up. You're not going to drink it all because you'll be very sorry you did that. You're just going to take the scoop of it. And anything like this you want to do, imagine if you got bloating and you have constipation and bloating and the pain that you can't go to the bathroom, you would definitely not want to just put a lot of such things in you, because it's going to carry it, it's just going to be too aggressive for you. So you want to start with spoons. You can take 1 tablespoon. So you can start with 2 tablespoons at night before bedtime for a few days. And then if it doesn't work for you, the next day you can increase it to 3 tablespoons at bedtime. And then next for a few days, and the next day you can up to like 4 tablespoons at bedtime. So that's another thing that we can do to help us. And the other things we could do, but I'll stop there so we can ask more questions, Pastor Sandra. And we see we're getting some questions in the chat. Why does pain medication cause constipation?
Someone put that in the chat.
Yes.
Okay,
So,
do you know how to bring that over?
I can see
Okay,
it here.
I see it now.
It's at the top. So one
There
of the
it
things I can make, some of the pain medications can slow down gastric motility. Just slow it down. Like for example, if someone had surgery and they gave them, because of the severe pain, they gave them hydrocodone. That's just how those medications work. They will reduce the pain, but it will slow down the movement of your bowel. And so this person will end up, that's why usually after surgery, someone will get constipated because of the medication they got. And they got that medication because they were in pain. And so that would help to slow down their motility. One of the other things too, that's why I said where a lot of things I just couldn't say, oh, but I wanted on this point, I want to talk about stress. Because when you're stressed, we have 2 major nervous systems in our body, the sympathetic and the parasympathetic nervous systems. One of them is supposed to fight for you and make you to get that strength to jump over a wall. If someone is chasing you, if that wall is high enough, you'll be able to jump over it. And that's because of your adrenaline that is in your body. And when that system is active, the other system, which is your rest system, is just supposed to, help you to be calm. That system is suppressed. And so when you consistently stressed, your other system is consistently suppressed. And that system is supposed to be the one, your vagus nerve, a certain nerve that controls a lot of your GI motion. That nerve remains suppressed. So it slows down your activity in your bowel. So consistently being stressed is something that we all have to work on. How can we manage things when they happen to us? How can we plan ahead to avoid those things from happening? Because this is going to really help us to have good bowel movements. So there are many things that can help us to have good bowel movement. We talked so far about making your own laxative at home, but we'll also talk about water. And I just wanted to demonstrate for us water, because that's a big question. Like, how much water should I drink? Maybe someone's going to ask that question. How much water should I drink? But there's a saying pretty much for those that want to drink 8 glasses of water a day. So what I'm going to share with us right now is just going to give you an example of what kind of glasses it's talking about. Is it talking about 8 glasses of this a day? Is it like 8 glasses of that a day? Or is it like 8 glasses of this a day? How do we know? Well, we know because it says drink 8-ounce glasses. 8-ounce. And when we look at our water bottle, usually a bottle of water has about 16.9 ounces. This is 16.9 ounce regular bottle of water. And I'm just going to quickly here show us what is 8 ounces of water. And so right here, 8 ounces of water is going to be that much, guys. That's about 8 ounces of water. Well, Dr. Pastor, I can't really tell because you got it in that your measuring thing. How much is that? Okay. 8 ounces of water is that. So this is a short glass. Let's compare that glass with this glass. 8 ounces of water. So doctor says, on average, you should drink 8-ounce glasses of water. Well, how much bottled water would that be? Dr. Pastor, we know I'm not going to measure it every time I'm ready to drink. Amen. So, how much water would that be? Okay, so let's see. That was the first one, right? So we're going to take this. and we're going to put this in this other glass. Let's put this here. So this is 8 ounce. So that's one. And we're still on our bottle. We'll measure another 8. And I don't have to do any measuring thing because on did it was about that much. So I think it's even more than the 8 ounces. But we're going to put this in here. And when we put this in here, so this is 2 8-ounce glasses of water. And so it says the average adult, which is about, 70 kilos weight, we should drink about 8 ounce, 8 glasses of 8-ounce water a day. See how much is left in our bottle? Just a little bit. So what does that tell us? That if we can drink, how many of this is going to make 8? So that would be 2 here, right? 2 of this is in here. Everybody with me? So then 2 of this is in here. It'll be four bottles of water a day. So 4 regular bottles of water a day will be about the amount that we should drink. Well, how can we do that? You wake up in the morning to make it easy. The easiest way to do anything is to spray it around in pieces. And so if we have 8 ounces of this to drink, 8 glasses of this to drink a day, which ends to be 4 bottles of water. First thing in the morning, drink a bottle of water. If you drink coffee, drink it before your coffee or after your coffee. And let me make that correction. Coffee is good. Coffee is proven to be good to help you with your bowel and overall health. So coffee is good. Just the excessive coffee makes you go to urinate throughout the day. 1 cup of coffee is good. So you drink your coffee, you drink 1 bottle of water. That's 2 glasses right there. And then you eat your meal and you can have another bottle when you eat. So yes, and you have another bottle. You say if you drink 1 bottle of water in the morning, and then you drink 1 maybe midday, and then you drink 1 when you eat your meal later, and then you drink 1 before bedtime, you get the 8 glasses of water in. And let's keep in mind that when you eat whole fruits, which is very encouraging, we've been encouraged to eat whole foods and not processed foods, because processed food is one of those top things on the list that cause constipation. So when you eat whole foods like your fruits and your vegetables, they have water in them, and that water we get from your fruit and vegetables kind of count towards our amount for the day. And so on here, I just have wanted to show a little bit of foods that we have. We can eat our vegetables, and they count towards the fiber in our diet. They count towards some of the and fibers. Food with fibers, our fruit and vegetables give us so much minerals and vitamins and what we call phytonutrients. They give that bright color, that bright red that we see in our foods, that bright green color we see in our food. They give us a lot of phytonutrients. So that those things are very good, very healthy for us. I want to take a moment here and just share something with us about foods we can eat all the time, and it don't matter. We can continue to eat a lot of them so long we don't have sensitivity to them. Are called like your green light eating is green foods. Green foods you can eat a lot of. You can eat as many as you want throughout the day. Vegetables, you can eat a lot of those. That's fine, no problem, so long your body can digest them. And I say that because there are some people who have difficulty digesting certain kinds of things. And that's another day discussion about why that happens. But it got a lot to do with the gut lining being destroyed. But let's say we had all these, we could eat these all day long if we wanted to. Take a healthy snack of some vegetables instead of eating different kinds of snack. Let's eat fruits and vegetables. You can eat carrots, stuff like that. These are green foods. Green foods are um, food that are in a natural raw state. Most of the time, you can eat them raw, like fruits and vegetables. They are called green light foods. Mean you the green light, like green light when the light's show when you're driving, green says go. They're go foods. They're green foods. You can eat them as much as you want. Make them snack. Make them healthy. They're good in fiber. They're good in nutrition. They help to keep your bowel movement moving, and they help something called our microbiome. Our microbiome are a group of microorganisms that are found in our gut lining, and some by natural the way the body is built, our body is not really able to break down fiber very well. And so we have those natural things called, sometimes you want to be really clean and everything, but just so you know, if you didn't know, you got a lot of bacteria in your body. You got like actually literally what they call trillions of them in your gut, and they help up to break down food. So when we eat the fiber, they able to help us break down our fiber for those ones that are soluble fibers. Your body can break them down by the help of your microbiome. And then when we get our stool in the toilet and we look at it, most of it, 60% of the weight of our stool is not from the food we eat, is from the microbiomes, which are that group of community, those microorganisms that we need to help us break down our food. So they are very good, very, very good, helping us with our fiber content when we eat. So these are all called green light foods. Green light foods, you can eat them as often as you want, much as you want. Nothing stopping you about those. You can eat those, eat them just as they are. But then there's something called yellow light foods. Yellow light foods are foods that we need. We need to eat them, but we have to eat them in moderation because in excess they're not good for us. And those are like your meat proteins and your eggs and um other stuff like that we can find ourselves wanting to eat a lot of. These are yellow foods. They're yellow foods because we got to cook them to eat them, and we don't want to eat in excess of them. We have to eat them in moderation. Does your body need them? Yes, they do, but in moderation. Your meats, your proteins, you have to eat them in moderation. That includes your bread, which are grains. Your body need these. We eat them in moderation, not in excess. Breads, biscuits, all that stuff. But some of them that are processed, we really want to stay away from processed foods. What are processed foods? So we talk about green light eating, and we talk about red light. We talk about green and yellow. Green are your fruits and vegetables. You can eat them raw. Yellow are the ones that you need them. They're usually grains like breads and stuff like that, but you eat them later at a time. Red light foods are foods that your body need. In fact, your body can live without them. So it's always stop and think before you eat them. Like example, yogurt will be a good yellow light food because it's protein, but it can be red. Red light is wait, stop, and think. Foods that have a lot of additives and food colorings. Food colorings are not good for your body. Things like that. Once we start adding all the things and you look on your ingredient, you see so many things in your ingredient, those can make your yellow food red. So just caution on as we stop and think, like ice cream. I mean, we all can eat them every once in a while, but those are stop and think. How much do I want to eat? Stop and think. How much do I want to eat of those things? Because when we eat too much of all those processed foods, they help to make us constipated, and that can be dangerous. When do you go to the doctor with constipation? You can do your own maneuvers, you can pick your own stuff, you can eat this, you can eat that. We have the internet now, people can search a lot of things. But if you find your constipation is not getting better with anything you have done, or if your constipation is over 6 months long, it's called chronic constipation. If you're starting to see blood in your stool, you need to go to your doctor. If you're starting to see your pain is just intensifying, you need to go see your doctor. Nothing's helping you. Don't do home remedies for those things. You need to go in and see the doctor, because imagine if your rear end gets blocked by a very, very dry stool, very dry, all the way down here, dry stool. No matter how you drink all the fiber, or fiber drinks, Metamucil, put it in the thing, stir it, drink it, or eat all the excessive fiber, all that stuff. You gotta let out, right, guys? Something gotta come out of here, else everything will continue to just buff up and pile up. And then it will keep going in the opposite direction. What is the opposite direction? Instead of it coming this way to come out of the body, through the rectum, like we saw here. Instead of it going this way, this is what it's supposed to be doing from the stomach. It goes there, small intestine. It comes here, across here. I got a missing part right here, but it should be the same green and black here. When it begins to bulk up, if this is not coming out, if this don't let out for more of this to come out, everything you're doing is just going to continue building and building. One of the complications of constipation, which can be dangerous and life threatening, is when it becomes obstructed. Your bowel becomes obstructed because of it. And it can happen. Impact, we'll call impacted feces, fecal impaction, when the food is like hard, rock hard, it's not coming out. You got to go to the doctor for them to help get it out. This food is going to continue backing up. Now that's what's going to happen. You're going to back up in the opposite direction. Now all this feces will back up in here, back up in here, back up in the stomach, back up in here, and you start throwing up greenish vomit. You start throwing up vomit that smells like poop. That's dangerous. Any time to play with that, it's time to see a doctor. It's before that time, it's time to see a doctor, because before it get to this point, you're gonna be in this stomach gonna be in so much pain, and you begin to see it distend. You're gonna start getting real puffy, and you're gonna be getting sick, because a lot of the germs, that was our good natural ones that we like them, but they're good under the right situation. So if the pressure begins to build up in here because there is no outlet coming, if it begins to build up in here, it'll start going in your bloodstream. And that's why the person can get what we say septic. You can get septic and the organs can shut down. Someone can die from a complication of constipation. I'm sorry to bring the bad news, but we're not going to wait for that to come. And so that's why we letting you know, if you constipated and you try few remedies at home and it do not work for you, you need to go and see your doctor before, and you're not waiting for your stomach to get so tender you can barely walk. No, 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 no. You can barely touch. If you try to touch your stomach and it's that painful, you need to go to the doctor. So they'll be able to help you.
So is there anybody on here that have questions? Because she gave a whole lot of good information. Do you have questions for Dr. Dahlene? I'm going to give you a moment to see if you have any questions.
We just want to say thanks so far for everybody being here. Cassandra, D, I see you. Thank you for being here. Janice, it's Karen, Linda, and others. I'm not able to scroll down right now to see. I think Pastor Sandra can do that, but yeah, ask your questions. We'll be happy to help you answer them. One other complication of constipation, long term, if your food is not passing down frequently enough, look, you can go to the bathroom 3 times a day and feel that empty movement. When you start eating whole foods, it's so good for you. It is so good for you. Less processed foods, whole foods, foods you can see is the whole chicken. You cut the chicken up, you fix it, it's whole food. You can see your fruit, you become so healthy. And so processed foods, because they don't have enough fiber, they take a long time in between here, and that can make changes to develop cancer. So some of the changes on here, there are many different changes on here, but cancer of the colon can come most of the time from the food sitting too long in the colon and is not passing down fast enough. And so that's what fiber would do, will help you move it through faster. Like every day you're supposed to go to the toilet, honey. Every day you should go. Some people go 3 times a day, and that just means they have enough fiber in their diet, they're drinking enough water, and it's passing the food down. But some people go once a day, and that's great. And maybe once every other day, okay, you can still work on that to make it better, but you should go every day, because think about it, our food have a lot of chemicals in it. Anyone heard of fake food? I've heard of fake food. I've seen fake food. I've seen fake. I've seen fake food. Let me leave it there. I've seen fake food, and fake food will stay in the plastic that is purchasing off outside of the refrigerator. You can last a year in the plastic,
So
like Twinkies or whatever like that. Those are
that's
made of chemicals. And so imagine when you eat those food, a lot of food, not just that, a lot of food have a lot of things in it. The longer it sit in here and not moving, the more time it has to act on the inside lining to cause problems. So that's what happens.
so, Dr. Darlene, someone asked the question. They would like to know. I would like to know more about chronic inflammation, how to control or get rid of it.
Colonic inflammation of the colon.
Yeah, it has to be. They didn't put the colon out there, but
Okay, colonic inflammation, that will be to correct our microbiome, because what can happen is, like I said earlier, the microbiome is this community of microorganisms that live with us to work for us. That is good. When they get out of hand, let's say they overgrow. And one other thing that can happen is, and to make you understand this better, is, let's say, for example, someone takes antibiotics. If you prescribe antibiotics and we take it for like excessive time than we should, or sometimes the doctor will let you know you're taking this for 5 days, but you might get diarrhea or something like that. That's not too long, but just some of them can do that. What the reason for that is because the bacteria, not the antibiotic, doesn't only help to treat what it's given for, but it also helps to kill some of your good bacteria that should be there. And so bacteria can overgrow. And sometimes when the bad ones overgrow, look, they're bad bacteria. They're gonna do bad things, like help to get your bowel inflamed. And then let's say you get constipated, the pressure that is in your bowel help to force those germs to enter into your bloodstream and enter into the part of the colon where it shouldn't be, so they cause inflammation. And so that inflammation and that redness, you can help all of that by helping to balance out your good bacteria that is in your bowel. And some of our good bacteria in our bowel can come from eating healthier, some of our fruits and vegetables. Fun fact, did you know that apples have something good in the core? In the core, the same natural bacteria that we find in foods, it's in apples, but they find them in the core. The core of apples, it's been found that the core of apples have like 100 million microbiomes in them.
really,
And that's usually the part we throw away. But just for example, that's the things that help us with our natural microbiome in our body. um People can have people take, sometimes they say you can take probiotics. Those are things that can be prescribed or over the counter, that some people can buy and take them. I'm not going to be able to recommend any one of them to anyone, but I will say check with your doctor and ask your doctor what's a good probiotic for me to take. Um, Probiotics are good because they help to balance out our good bacteria. You can get them just from eating yogurt, Greek yogurt that is plain, and I do not recommend yogurt that has that sweet. It doesn't do anything bad to your colon because it's sweet, but what that sugar does is just added sugar. Added sugar is just not good for you. It's one of those things when they process the food, they dump some sugar in there. And so not anything with added sugar, but just eating plain, natural, plain yogurt, that can make it a part of your lifestyle, that can help you to balance out your microbiome in your bowel. And once that happens, once that get balanced out, it helps us with it. But something else that can happen with people that can cause that inflammation of the colon is called SIBO, which is small intestinal bacterial overgrowth. And when that happens, it has to be a gastroenterologist that can help you with a cure for that. And that overgrowth of bacteria can cause a lot of inflammation. And when you go to your doctor, they will have you to do a breath test to see what gas is being produced. There, one of them can cause one kind of gas, and another kind can cause another kind of gas. But there are two main types of the small intestine bacterial overgrowth. One comes with diarrhea, the other one comes with constipation, and then third kind comes with bacteria and constipation. So it has to take your gastroenterologist to do those tests for you and to work it out, work you through with it to be sure what is the cause of the exact thing that is causing that inflammation, because it goes along with what we call inflammatory bowel disease, which is part of, your bowel being inflamed and being red. And so those are things that can be treated primarily with diet. Once the doctors know what's really going on with you, they ask you to cut certain things out of your diet. So for some people, it can be caused by gluten. Now, we've heard a lot gluten-free. I'm sure we've all seen gluten-free this and gluten-free that, and you might be thinking, what the heck going on with that? Gluten-free. So what is going on with that is some people are not able to process wheat and certain kinds of natural foods because studies have shown that it may have been a food poisoning that they had a long time ago, and it damaged the lining of the small intestine. So the small intestine is here. What's my small intestine? The small intestine is here. So inside the small intestine, it damaged the lining of it that's supposed to be able to break down certain kind of carbs. Certain kind of carbs. The body got so many enzymes. But certain kind of carbs are supposed to be broken down by certain kind of enzymes in our body. And when someone has this severe inflammation of the stomach, earlier on, they did not know it, but somehow there was something that happened in the bowel that caused that layer, that protective layer, that layer that's supposed to break down that particular kind of food, got destroyed. And because of that, when a person eats that particular kind of food, like some people can't eat certain kind of bread, some people can't eat certain kind, it gotta be gluten free. Gluten is a kind of carb. If they eat gluten, it strikes up an inflammation process in their bowel because their body has built up what we call antibodies, and your antibodies are protect. They actually supposed to protect you. And so when that, let's say for example, when that food poisoning occurred way back then in that person's body, their body built up antibodies, which are your natural immune system fighters. They come and fight for you. Like, I remember you, I remember you, I remember you. So every time you eat that food, they come up and they're like, I remember you, I remember you, I remember you. And you're not supposed to be, I'm going to destroy you. You're trying to destroy this body. No. And by them doing that, they cause that inflammation process. And so until that can be kind of taken care of by your doctor, or by the person's doctor, it'll be hard, to do that. And they will help you to know exactly which kind of foods not to eat and which kind of foods to eat that the person got to stay away from this, stay away from that. And then the goal would be to eventually help you to heal and cure from it. But that is a separate thing that is causing it that doctors can help to work with people for. So if someone has inflammation of the bowel, inflammation like inflammatory bowel diseases, they can be worked with by doctors.
Okay, so this has been really, really good information for us on today. I just want to know if anybody have any questions before we close out. Any more questions? Let's see if this is a question here. Uh, okay, hold on. Let me put this here. Can you see that, Dr. Darlene?
Yeah. She's saying that I had malrotation at birth because my intestines were infused together. I had chronic constipation issues. I eat vegetables and drink a gallon of water daily. I strained to the point of bleeding. My doctors have never had heard of the surgery, so there've been no help. What can I do? So the surgery, the name of the surgery you had is the name that you said never heard of before, and that was malrotation of your intestines. You had malrotation of your intestines at birth. Can you type that for us? So you strain to go to, okay, yes, and that's the number. Yeah, I'm familiar with that. Some babies can have that is a congenital malformation, but they can have malformation or the intestines, because at development stage in the embryo, there's a certain time where the bowel will develop in one way, and at a certain time, most of the bowel develops outside the body, believe it or not. And then at a certain age, when the baby gets that age, it's supposed to pull back in the stomach, the abdomen area, and seal up. And sometimes it can flip in the wrong direction. Um, I'm not quite sure what to do about that. I'm familiar with the situation, but I'm not quite sure what to do about that. What I can say is take these tips instead of straining to the point of bleeding. Try to use that maneuver when you need to go to the bathroom, and let them watch and see. Watch yourself and see. Do a full food journal and see what how your body reacts to different kinds of food, so you can be able to know, okay, when I eat this food, this is what happens to me. Stay away from that food for a
Mm-hmm.
little bit, because journaling, food journaling, is a good way to learn more about your body, learn more about yourself, especially if you're having digestive issues, are you having issues with chronic constipation? Yes, journal what it is that is causing you to to have those symptoms. And maybe when you look back at the end of the week, you'll be able to determine it. Weekly, keep a weekly journal of it. A full journal, which could just I can send the person one of those if Pastor Henry give me the information, or you can search for food journals. So that means you will record Monday. This is what I ate for breakfast. Write down everything. Don't eat too many variety of things in one day. Then that way you're gonna be harder to detect. You know what I mean? Yeah, but that's a way to do. You can journal, do a full journal, and you'll be able to look back and then mark how your bowel formed and how frequently did you go, because that's important when you're saying constipation. Someone want to know how many times are they going to the bathroom. What does this stool look like? It should look like a sausage. It should look like a sausage. Is it in little knots? Or is it long? Is it continuous? Is it long but got like breaking in between? There are different ways to look at it too. And we can find out when we'll call it Bristol scale, Bristol, your Bristol scale. If you can write that in, Pastor Sandra, please write that in so they can look it up. The Bristol B,
How is
like
it spelled again?
B like boy, R like Raymond, I like India, S like Sam, T like Tom, O like Oscar, L like Larry, Bristol scale. It'll show you a picture. So it just kind of looks at the different kinds of stools and helping to use that, the different ways how stools look to help patients determine, am I constipated or not? Some people don't really know they're constipated or not. So this might help you. SCALE, Bristol Scale,
Did I spell it?
SCALE. Yep.
Spell something wrong?
Yeah, that's the work word, but just so they know it's SCALE, like a skill, and then they use that skill to determine what my stool looks like. There are pictures that you can see. The number one is extreme constipation. Number four is where we need to be. Number seven is diarrhea. So we need to be right in the middle between 1 and 7. We should be like in the middle, like before. Four is
Okay.
normal stool.
That's awesome, awesome, awesome. Let's give Dr. Dahlene a hand clap. I don't know if you're able to put any hand claps out there or stars, however you can do it, but this was just full of loaded information for us on today. Everybody has something to take home with them on today. So we are Darlene, Pastor Darlene. I want to say thank you so much for joining us on today on Sandra Burnett Lifestyle. Our first podcast, she was on our first podcast, the 7:30 podcast. And she did an awesome job. And we want to say thank you. Thank you. Come on, put in the comment section. Thank you, Pastor Darlene. Come on, put it out there so she can see that you appreciate her. I see somebody put some hand claps out there. Thank you so
Thank
much
you.
for that. All right, come on,
Thank
you guys,
you.
put it out there. We want to say thank you for her work. Thank you, looks like Judy put it out there. Janice right out put it out there. Thank you so much. Come on, we need you to put it out there for her. Thank you so much,
So yeah,
Dahlene.
I want to thank everybody, and you can contact or you can reach me on my social media. I'm on Instagram as well as Facebook, and also YouTube. I also sing gospel songs, so check
Yes.
me out on Minister Dr. Darling Brown Paasewe. My name just like it is on YouTube. You say it's there, and I'm going to be opening a health channel in the next few weeks. So look out for that so you can be a part of it, where we'll just be doing this, talking about health. And I also have, where is that? Health coach. Like I said, I'm a certified health and wellness coach. And anyone here today, you can follow up with me and we can be able to do a free, send me a message on somewhere there. Let's see if I can get this on here. Yes, you can have a free 30-minute session with you and whoever, and then we'll take it from there. Send me a text and we can connect from there. You can do a screenshot on that if you want. Free 30-minute session with you and anyone of your choice. Your time. You pick your time. We'll make it work. Or we'll take a time that I have and work together for the first free 30 minutes. Talk about what you want, and you tell me the topic, and that's what it's going to be.
All right. Well,
All right.
Paasewe, thank you so much. I so again appreciate you being a
You're
part
very
of
welcome.
our very first Sandra
I'm
Burnett
excited.
Lifestyle podcast. I've been telling all of my followers that I was going to be doing this podcast. And I want to say thank you guys for all of those that joined on
Oh, it's
today's
upside down. Okay,
invitation.
I'm sorry. It looked upside. Okay, maybe just what it's
Yes,
saying.
it's because of that's the way the camera is. It's
Okay,
making it
okay,
look the other
okay,
direction. I don't think it can be corrected.
okay. That's fine. I'm going to type it. Hang on here. Let me just type this in here. You can reach me here. And
So
just say you were on Pastor Sandra's podcast, and
right,
then
yeah.
we'll so that I can be able to know, and then we can connect from there. That's my email, dbpaasewe@gmail.com.
Okay, so you guys make sure you take that information and follow her also on Facebook, where she gives really good information on health. I want to say thank you guys so much for joining me on today. I so appreciate you. I want you to make sure that you consider becoming a uh, member with my Sandra Burnett, becoming a member with the Crown of Glory.biz. The membership start actually as low as $3.99 monthly, and that will help me to grow and to venture out more and reach more people with from hair to faith to lifestyle. I do want to say next week for our podcast at 7:30 p.m. I'm considering doing something for women over 50. And so I want you to make sure, and brethren, you are more than welcome to come along and to join us, because it can also help maybe your wife or your girlfriend. But
That's
I'm considering
right.
doing something over 50 where it's going to be such a helpful tool, a blessing to you. So I want you to make sure that next week, next Thursday, 7:30, meet us here on my podcast, Sandra Burnett Lifestyle. And then also next Tuesday at 5:45 a.m. Jumpstart your morning with growing in the word. And it's been powerful teaching that we've really been enjoying. And then also, I want you to go on to my YouTube page where I have all of my videos. I believe over 200 videos dealing with hair, dealing with lifestyle, dealing with
Awesome.
faith. Go check me out, Sandra Burnett Lifestyle. Again, I want to say, Pastor Dr. Dahlene, thank you so much for joining me on today. I so appreciate you. Such great information. You know, I love you. I tell you, you are my sister. What they say, from another mother,
That's
another father,
right.
somebody. But I want to thank you so much
You're
for
welcome,
being a part
Pastor.
of this. And again, all of
Thank
those
you for
that
having me. Thank you for the invite. Thank you for having me.
more
It's been
than
a pleasure
welcome.
to be here. And
More
thanks
than
to
welcome.
all of you for being here. I hope we're able to scroll through and see your questions that you had. We don't want to leave your questions unanswered, but hope you don't
Right.
have any. If you did and we didn't answer it, please kind of bring it to our attention right now. But we just want to thank you, appreciate you. Thanks, everybody.
Right. And so with that, we are going to close out. You can always reach back out to me if you want to need more information that I can give to Dahlene, just Dr. Dahlene, just let me know. But with that, again, thank everybody for joining us on today. And everybody have a great day. All right. A good night. Bye,
Good
everybody.
night. Bye, everybody. Thank you so much. I look forward to hearing from you.
All right, Pastor Dahlene.
Okay, Pastor. Thank you.